Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast.
I am so excited. It's now summer. It means longer days, more swimming, lots of grilling, a lot of fun to be had.
And of course, more time to listen and record podcasts.
Absolutely. Absolutely. Welcome to all of our listeners today. We hope you're having a great week.
Not only do I get to hang out with you again, Cari, but also we get to see my very good friend, Dr. Erika Radford, back on the podcast for the second time again. We never get sick of hearing her advice. So welcome back, Erika.
Me too. We always love talking to Erika, our college health guru. Today's a little bit of a sensitive topic. We're going to talk sexually transmitted infections, or STIs, as we will refer to them for the rest of the episode. And then we're going to talk Tyson. Yeah, Mike Tyson, friends. So stay tuned after the lowdown on, we'll go over peptic ulcer disease for our Hollywood hype, or I guess also sports hype segment.
So this was a highly requested topic, and one we were really glad to have Dr. Radford answer all of those pressing questions about. It was really one of those things that listeners submitted to us and just requested that we talk about. And so we want to talk about, maybe put your headphones in if you're at work or around the kids. This is your, you're maybe not safe for work discussions, but it's medical. We're here to talk about it.
Absolutely. It's like our warning we put out there, like trigger warning.
Yes, trigger warning. Trigger warning today. So for all of you who may not remember from episode 4, Dr. Radford is the Assistant Medical Director for Student Health at Texas Tech University. Once again, hello, Erika. Thank you for being our first repeat guest on the podcast.
Thank you all so much for having me. I'm so excited to be back.
We really appreciate your expertise addressing these topics. This can be a sensitive one to address, but very important. There are more than 1 million sexually transmitted infections every day worldwide, and most are asymptomatic. So if you're out there thinking that you've never known someone who's had one, I'm here to tell you, you have.
And although we address this more with our younger populations, it's really not just seen in the college health population. When talking about herpes simplex virus, more than 500 million people from age 15 all the way up to about 49 are estimated to be infected. Erika, tell us, what are STIs?
So STIs, or sexually transmitted infections, or as I call them, crotch critters, are a group of more than 30 bacteria, viruses, parasites known to be transmitted through sexual contact. This can include vaginal, anal, oral sexual contact. Some can also be transmitted from mother to child during pregnancy, childbirth, and during breastfeeding. The spread of these can happen anytime there is an exchange of blood, semen, vaginal, or other body fluids.
Okay. Out of this group, what are the most common, what we call, pathogens, but the things that transmit infection that cause STIs?
So we have our top 8 pathogens, and these will cause the majority of all STIs, or sexually transmitted infections. 4 are viral and 4 are bacterial. The 4 bacterial that are currently curable are syphilis, gonorrhea, chlamydia, and trichomoniasis. The other 4 are viral infections and include hepatitis B, herpes simplex virus, which is HSV, HIV, and human papillomavirus, HPV. And yes, it is a huge problem. For example, in 2020, there were an estimated 374 million new infections in people 15 to 49 years of age, with one of 4 curable bacterial STIs that we just mentioned.
Wow, that is a lot of cases. Now, even though some of the STIs we mentioned are curable, it is important to know that even the curable ones can cause problems. For example, HPV, as Erika mentioned, that infection is associated with over 300,000 cases of cervical cancer deaths every year. That's a lot. 1.1 million pregnant women were estimated to be infected with syphilis in 2022, resulting in almost 400,000 adverse birth outcomes.
And syphilis is one of those things we used to talk about in the dark ages.
Yeah.
That was like medieval times discussions. And syphilis itself has actually increased dramatically, especially in the area in the region where we actually live, in West Texas here. We've had a significant outbreak of this medieval times infection. And it's something that we really need to be talking about and aware of.
Absolutely. Especially since, we talk about this in the student health population, but it's really not just that group, for sure. And STIs in general have a direct impact on sexual and reproductive health not just through stigmatization, but infertility, cancers, pregnancy complications, and can increase the case of the risk of HIV. Erika, what is an effective way to prevent STIs?
Yeah, I'm glad you bring up stigmatization because that is one of the biggest barriers, and the biggest way to effectively prevent STIs is going to be condoms. Having that discussion with your partner. So condoms are the most effective method and should be used for vaginal and anal sex for STI prevention. If you or your partner has a vagina, use a dental dam for oral sex. There's also vaccines that can be for prevention as well. There's two viral STIs that have a vaccine for it, hepatitis B and HPV. But that being said, if there's an STI that has like extragenital sores, like HSV herpes, if you touch, condoms will not protect you.
So, what kind of symptoms would someone have if they have an STI?
So that's the thing about STIs. Most of them are asymptomatic, which is why testing is so important. So they're often asymptomatic, which is how they get spread so easily. If you do have symptoms, I mean, they can be anything. They can be sores, bumps in the genital area, oral area, like the throat, in the rectal area, painful, burning urination, UTI type of symptoms, discharge from the penis, discharge from the vagina. Sometimes this discharge can have an unusual odor or color, pain during sex, unusual bleeding outside of your regular period, even rashes on the hands, feet, trunk of the body, fevers, jaundice, which is your skin turning yellow. You can have weight loss, joint pain, night sweats. As you can see, a lot of these symptoms are vague. So even more reason to get tested on a regular basis, especially with new partners.
Because I think that's what happens a lot of times is my patients, when I ask them when was the last time they had the STI testing, are they here today and they want to do STI testing as part of maybe an annual wellness exam? They say, oh, I think I'm good. I don't have any symptoms. Well, I think that number one, you may most likely are asymptomatic even if you did have an infection. But number two, I don't think the last thing that you're going to think of when my joints are hurting is that I might have a sexually transmitted infection. So I really have
Yeah.
to change the way we think and talk about these infections. And so it's not just the classic, oh, I'm having, genitourinary symptoms, right?
Right. And I want to say some of them, these vague symptoms are self-limited. So it
Right.
may be that, by the time that they come to you, um, that could have been weeks or months ago, right? And they don't remember that. Like I had a few days of fever, joint pains, and it kind of went away. And as a college age kid or a younger person, it was just like, I had maybe the flu or something and move on.
Well, especially so like when we talk about certain illnesses, let's go back to the medieval times, syphilis, it actually has different stages. We learn about this in medical school and training. There's different stages. You're looking for where it is at in that progression. And it's as something as simple as maybe this, rash or some lymph node enlargement, all the way up to where it affects your spinal cord and goes to your brain and can cause long-term effects on your body. And you can go crazy from syphilis. I mean, we've heard about that in those medieval stories and things about somebody gone crazy from this infection. Well, hopefully we're not getting to that level with most of our population, but this infection is there and can progress.
Absolutely. But say you had those symptoms or you had an exposure. Is there a way if you can find out if you have an STI?
Absolutely, yes. Thankfully, testing does exist, and there's even rapid testing too. So we've got rapid tests for HIV, syphilis. You can get tested for hepatitis B, and you can get that a variety of ways. Checking your urine, blood. There's cheek swabs. There's swabs from a sore. There's testing discharge from the penis, vagina, anus, depending on what you're checking for. It's mostly painless, so important to remember that. Many healthcare providers, like Jessica was talking about, recommend annually sexually transmitted infection testing if you are sexually active. You may need testing more often, like every 3 to 6 months if you have multiple sexual partners. Some providers recommend testing before having sex with a new partner. This is a discussion I have a lot with my college students. I say, this is not like the sexiest conversation to have when you're with a new partner and you're having this discussion, but it's really important, and it actually may help to build some trust and foundation of the relationship. And actually, this new generation is a lot more about getting tested. Sometimes they come to visits together and they're like, we're here to get tested together and print out our results and show each other and go forward from there. And I think that's awesome.
Oh, I like that. That's good, right?
Right. And this part of our discussion, you guys are probably gonna laugh. This totally reminded of our conversation last night because we literally just talked about one of the most popular shows on Netflix
Oh my gosh, yes.
for
Okay.
Bridgerton. And like literally, we were like, every time they show one of those brothers and then they like go for their potential wife, and you're like, get tested for STDs.
We
Like,
definitely were talking about Bridgerton last night. Well, for sure. Yes, we all know maybe what scenes we're talking about where the boys seem to have some relations, with some other people, sometimes multiples.
Yep.
And all of a sudden I told Carrie, I was like, girl, this is syphilis all over here. These poor girls when they're going to get married. And so these are the problems you have to think about. Unfortunately, they didn't, I guess, know better back then, but we do. And apparently this new generation that Dr. Radford's seeing in her clinic is really aware. And so I think that's really great. Having these conversations and taking away some of the stigma and the taboo is going to be important in how we're going to combat things like medieval times infections coming back and affecting people and affecting their health long term.
Yeah, absolutely. We're talking about partners, for example. What are some things that you maybe could ask your potential sexual partner to kind of gauge the risk of getting an STI?
Yeah. So again, not the sexiest conversation to have, but super important in building that trust foundation, right, in a relationship. But yeah, you want to ask them if they have active STIs. When was your last STI test? Are you currently being treated for one? Do you consistently use protection? I tell all my patients to carry condoms with them, male, female, non-binary, whatever. You carry condoms with you. You have them. That way you know that you've got that with you if you're having any kind of penile related sex. And it's funny that you bring up like the Hollywood stuff, because what I think about is not so much Bridgerton, which is fictional, but like reality shows. I'm like, is there a van outside, maybe like a clinic? When
Oh no,
they're
but
like the
there's
dating shows, you know what I mean?
yes,
Like,
yes,
what?
yes. So, like, but I guess we could, but The Bachelor. I actually read a tell-all thing about them talking about how they did not, per this one person, so I can't validate this, they did not provide those things like condoms and things that they probably should have.
No,
And
no,
the
no.
person on the show felt like that was inappropriate, that if they're going to have the fantasy suite and all of those things, well, they either need to be all tested, which I don't know the background on that part before you get on the show, or providing, even at the same time, still should be providing protection. And so it was a very interesting, like behind the scenes, that they make it all look like it's this just fantasy love world of everybody just falls in love and it's all great. But it's
Yeah.
like, we have to realize there is a reality to being in relationships and having these partners and making these decisions,
Absolutely.
and what we do, you want them to make a smart decision. We want them to not do this, without thinking about these things in at full length and understanding. We're not trying to scare anybody with old school health tactics, showing the scary pictures and saying, don't do this. This is what will happen to you. We're saying that, if you're going to make these choices, then we need you to be making informed choices so that we can protect the health of you, your others, your future fertility. If you're pregnant, your baby.
Yeah, it's just real life. I mean, it's
Real
just real
life.
life, right?
Mhm.
I mean, it's sex is a part of life. And so you got to be able to have those conversations. And yes, they're a little bit awkward, but again, I mean, these are, somewhat awkward situations in themselves. So you got to be able to have awkward conversations about them,
Yeah,
That's what,
definitely.
and there's no judgment. It's just a part of life.
Absolutely. So, we've talked about what STIs are, who gets them, what symptoms you may or may not have. We talked a little bit about treatments. We talked about things like, for hepatitis B, antivirals help fight that infection. Certain ones we treat with antibiotics, certain ones we can protect against by using vaccinations like, HPV vaccine. We talk about that a lot. We really promote that vaccination. If you're unsure if you had that one, just as a side note, it's not one of the routine required vaccinations of childhood. So a lot of my patients who come in, maybe they're in college, they say, well, I got all my childhood vaccines. That's great. Or they say, I got everything I needed to go to college. Unfortunately, college doesn't ask you about having your HPV vaccine. And this is for men and women. You can both get HPV vaccines in childhood. And if you did not receive them in childhood, you can get them as an adult. So we just want to make sure that that you can check your vaccine list. If you have a copy of your vaccine record, you can talk to your parents. You can call your pediatrician if they're still around too and try to find those records. So it's really something that most primary care clinics, even the pharmacies, are giving out some of these vaccines now as well.
Mm-hmm. Absolutely. Yeah. And I know we just kind of maybe briefly mentioned it, but as far as for some of the treatment options, for some, it could include antibiotics, for example, like we talked about. But to note that there has been some issues with antibiotic resistance that has popped up for some of these diseases. So just be aware of that, because that's going to make it harder for us to treat in the future, instead of being like, oh, it's single dose, no big deal, but it may not be an option in the future if antibiotic resistance still increases as
Definitely.
well. And then, of course, also some antivirals for some of the ones that are more common for viruses as well. But just in general, also remember it's treating both partners. Also, that's important as
I mean,
well.
we could talk all day long about treatment
Oh, yeah, for
options,
sure.
treatment things. I know Dr. Radford does this all day long as well. There's a lot of different options. I think one of the main things is we're going to talk about like an antibiotic option that I would want to remind our listeners to is that you must finish all of the antibiotic. And even more importantly, your partner has to be treated as well. So it can't be just you get treated and then you're maybe ashamed or don't want to talk about it and then you go back with your partner. If you have the infection, your partner will be carrying this infection as well, or at least needs that treatment as well. So have these open conversations like Dr. Radford's been talking about. Make sure that you can talk to your partner about this. There are certain states that allow the doctor or provider to prescribe a prescription for both the patient that they're seeing with the active infection as well as their partner without ever actually seeing the partner. Dr. Radford, can you comment a little bit about that one? At least here in Texas, that's what we see as well, correct?
Yeah, so just to kind of go over a little bit about the treatments, the regimens of antibiotics, we've got our most common ones, which are chlamydia, gonorrhea, and syphilis. They're bacterial. And just to clarify a point earlier, trichomoniasis is actually a parasite. It actually looks kind of cute under the microscope, but not cute to have. Not cute to have. And if you find yourself with one of these, they are curable, with a caveat of that there is increasing antibiotic resistance, like y'all were talking about, especially with gonorrhea. That's actually quite terrifying because we are running out of options for this multi-strain resistant gonorrhea strain. And so we're able to cure most of these. For herpes, HIV, we've got some antivirals that can help, although they are not technically curable. Hepatitis V, we also have antivirals that can help as well with slowing damage to the liver. And like y'all said, and I just want to reiterate, we must treat the partner as well. And actually, at least in the state of Texas, we are able to prescribe treatment for partners without even seeing that partner.
Which is awesome, because then that again goes back to that stigma. Let's try to go ahead and just treat it. We're trying to not let something spread that can be so infectious and cause so many long-term problems.
Okay. Absolutely.
So again, we've covered all these aspects of STI infections. And so hopefully for all of those listeners who have asked and begged us to give you this one-on-one talk about, what we're talking about with who gets it, how this is happening, what's the spread, what treatments are available. We just want you to be able to feel comfortable having an open dialogue with your partners.
Absolutely. All right. And now on to our Hollywood/sport type segment this week. I've had a few of these segments now, but I think I might be able to say that this is one of my favorites for two reasons. First of all, it's gastrointestinal in nature, which, let's be honest, is the coolest part of the body. So I'm just going to put that out there. It's true. Second, I have somehow managed to talk about Mike Tyson on a medical podcast, which I feel like is a win.
Absolutely.
Just saying.
I mean, we've covered what? Real Housewives, Paris Hilton,
Bridgerton. I knew she would bring up Bridgerton today.
Well, you knew I was going to throw that in today.
We had to. I mean, got to cover Mike Tyson at this point.
It's all that's left, really, at this point.
So for those of you who may not have actually seen the headlines, it's how Mike Tyson's mystery illness could be deadly. Definitely provocative headline there.
Clickbait.
Yep. We are here to fill you in on what actually happened and maybe how you can, quote, protect yourself so you're not end up like Mike Tyson. So on a recent flight from Miami to Los Angeles, previous heavyweight champion Mike Tyson had a medical scare.
Per reports, about 30 minutes prior to landing, he became dizzy and nauseous. Paramedics did tend to him upon arrival to their gate. And Mike Tyson and his team, I guess, reported that this was due to a flare-up of known peptic ulcer disease of the stomach.
So, Carrie, no wonder you love this segment. Any way you could sneak in a GI topic, you will. Now, we know you are not and won't probably be Mike Tyson's physician anytime soon.
Unfortunately.
But what does all this mean? Can we get some facts on peptic ulcer disease? And, we may call it PUD in this segment. What is it? What's happening?
Yeah, first of all, I thought you would never ask, so thank you. And secondly, like, I'm not really sure, to be honest with you. Like, that's a very kind of loose slang term of like a flare up of peptic ulcer disease. Really, it's just having symptomatic ulcer disease more than anything. But we'll talk about some ulcer facts. So, a peptic ulcer is a sore in the stomach or the duodenum, which is the first part of your small intestine that connects from your stomach. Peptic is actually arrived from the word for pepsin, which is the main enzyme produced by your stomach to help you break down food. Generally, your gastrointestinal or your GI tract, it makes a protective layer to insulate it from substances. But in PUD, that protection has basically failed, and digestive juices that we all have are actually able to kind of start corroding through the lining of the stomach.
Sounds really interesting. I feel like a lot of people say, I'm getting an ulcer, I'm so stressed out, I have my ulcer. So how common is peptic ulcer disease?
Yeah, that's a great question, Dr. Radford. About 5 to 10% of the population worldwide will develop peptic ulcer disease or PUD in their lifetime. It can develop at any age, but really the most common is middle-aged adults, and it's actually a little bit more common in men than women. 80% of peptic ulcers are actually in the first part of the small bowel, and about 20% occur in the stomach.
So, what symptoms do you see with peptic ulcer disease that would, flare up? When they're kind of saying he had a flare up. So, we're
Right.
talking about symptoms. What symptoms did he have?
Yeah, and interestingly, actually up to about 70% of the people who have them, which may be found, like I'm assuming incidentally on some sort of endoscopy or something like that, may not actually notice very many symptoms. People who do have symptoms complain of pain in the upper part of their abdomen or their belly, may have some indigestion, bloating, belching, loss of appetite, some nausea, for example, has also been reported.
Oh, thank you for saying the word indigestion because I hear that word all the time. And I think it's very common now after that Pepto-Bismol commercial that's like nausea, heartburn, indigestion, upset stomach, diarrhea. Carrie knows the dance.
That's right.
So, like, what actually is indigestion? Do we know?
So that's great because it really means different things to different people. So it's epigastric pain with notable burning quality is really kind of the accurate way to describe it.
And when you say epigastric pain, so
Yeah,
for our
epigastric, top of the tummy. So basically kind of where you're underneath, well, if you're a woman, underneath where your breasts are, underneath the nipple line for men, kind of right in the central part, underneath the rib cage, that would be what we consider the epigastric region. And sometimes people will say that combines with a feeling of like fullness in that area as well. And usually it comes shortly after eating and or last long time after, basically. So some people describe it as like a gnawing sensation. So that's kind of, I think, the best way I always ask people is like, does it feel like it says gnawing in that part of your stomach, or like burning, gnawing pain is how I really get people to try to describe it to me.
So if I was told I had an ulcer, maybe by a physician, which that's probably who's going to tell you have an ulcer.
Hopefully. TikTok may also tell you have an ulcer.
That's exactly what I was thinking. I was like, well, TikTok may have already told you that too. How would I know where it's located?
Yeah. So we have like a general rule of thumb. Obviously, it's not 100% accurate, or we wouldn't really have to actually, even look at it and test people. But a lot of times with stomach ulcers, people will say that it feels worse shortly after eating. Whereas with a duodenal or first part of the small bowel ulcer, generally they say it feels better after they eat and will get worse hours later. Sometimes people will actually mistake it as a hunger pain. So they'll actually think their body's telling them it's time to eat again. And really that's actually more of that ulcer discomfort that's flaring up. But again, it's not 100% accurate.
I do remember that being a quiz question, like in our medical school textbooks and stuff. So for anyone here who's listening for CME credit in med school or something, just remember that probably still is a test question probability.
Sure, yeah.
But
and it's a good rule of thumb to remember. Like, it's not 100% accurate, and you're also assuming that you as a patient, or if you're seeing a patient, I mean, it requires some degree of paying attention.
Right.
Like, you're busy, you're running around. Yes, sure, I didn't feel good, but was it related to eating? I don't know. I wasn't paying attention.
And this is, again, we've talked about food journals and diarying symptom logs and things. This is where that may come and help handy. So what causes a peptic ulcer? Why would I have one?
Yeah. So the two main causes of peptic ulcers are, first, an infection with a bacteria called H. pylori. Now, nearly half of the world's population has this bacterium in their stomach and their small bowel. And for most people, it causes no problems. So, a lot of people say that they hear about this and they worry that they have it. But if it overgrows too much, it can actually cause an inflammatory response in the stomach. And that actually wears out that gastrointestinal barrier that we talked about. And that's when damage starts occurring, because you're basically causing so much inflammation that the barrier gets worn down. The other main cause, which is my arch nemesis in life, is NSAIDs. Okay. So it's like, literally, if you throw that word out to a gastroenterologist, most of us just get like full body chills. It's so irritating. But so those are over the counter pain relievers like aspirin, ibuprofen, naproxen, meloxicam, to name a few, not Tylenol. That's always kind of the one I throw in there. So not Tylenol. And basically NSAIDs, what they do is they inhibit something that we call prostaglandins. Okay. It was just basically a fancy term for the thing that helps repair damage to that protective barrier in the stomach. So just from normal activities like eating, we have to have juices in our stomach that are very acidic, and they help break down our food. That's how we start our digestive process. And in between the episodes of needing our stomach, it has to build that protective layer back up. And prostaglandins is one of the ways we do that. And NSAIDs inhibit that. That's where a lot of that damage occurs, so that those juices that we have in our stomach are actually able to erode through. So that's kind of where ulcers come from.
And if somebody has a question, if a medicine they're taking is an NSAID, NSAIDs say it on the bottle too. It'll say it's a non-steroidal anti-inflammatory drug. It says that word on there.
I feel like when I see this in clinic, I name like 30 things off.
I do
because
too.
Even through residency and fellowship, I've had to learn like goody powder, BC powder, like all these things to throw out. And it's funny because like I'll go through the list and they'll be like, no. And finally like, oh yeah, no, I'm on that. It's even like, you can see there's like a trend. So, it's hard to know because there is a lot of them under different names out there, but you're right. It should say it on the bottle.
Brand names and generic names too. So look for the bottle.
Yeah. And also alcohol and smoking can also contribute to weakening that protective barrier as well.
So if someone thinks they have an ulcer and goes to their doctor, what kind of evaluation would they expect?
Yeah, so it's funny you should ask that, Erika, because that's exactly what I found interesting about this whole Mike Tyson story. Like, he walked off the plane, the paramedics chatted for a little bit, and then they were all like, oh, you have an ulcer. Okay, we'll just treat that. And that happens all the time. Patients will come into me and they'll say, like, I was told I have an ulcer. Like, I know that's what it is. Like, how do I treat it? The pain's still there. Like, what do I do? And I'll be like, well, what kind of workup did you have done? And they're like, well, nothing. I just told them about my symptoms. We had a little chat and they told me I had an ulcer. And you can't really diagnose peptic ulcer disease from just a chat. Sure, you have symptoms that kind of suggest that. And, it was funny that you mentioned about people saying like they came in and there's like, these symptoms, my stomach hurts, I have an ulcer. And there's different levels of inflammation. So for example, gastritis or just inflammation of the stomach lining is not truly an ulcer, but it can still be uncomfortable as well. So it's kind of a spectrum that I would say also. So it's not necessarily all that it has to be a true ulcer to have symptoms. But in general, usually you're going to want to have a procedure called an upper endoscopy. And that's what I do. So that's basically where we put someone to sleep, have a long, skinny black tube. It's got a camera on the end. While you're asleep, we'll put it in the mouth, look at the esophagus, stomach, first part of that small bowel to look for things like ulcers. And that's really the best way to test for these things. We can also take biopsies during that procedure to test for that H. pylori bug that I mentioned. There are some other ways you can test for it as well, but directly visualizing these ulcers is really the most accurate way to test for it. Sometimes if it's really big or if it's had a complication, a CT scan could pick it up, but it's got to be pretty good size for that to occur.
What kind of treatments are there for peptic ulcer disease?
So overall, we talked about the underlying causes. So really avoidance is the main thing. So for example, if you have NSAIDs that you're taking, then you want to try to limit it to the shortest duration for the littlest amount possible. Of course, there are some people, and this is why it's important to talk to your doctor about it, that have to be on some of these type of medications for other diseases that they have. And there are actually recommendations for putting them on what we call proton pump inhibitors, or PPIs, basically, and putting them on for a longer duration than we normally would to help prevent some of that breakdown. So there are some people that have to be on these medicines, and we do our best to try to prevent damage. For H. pylori, we do have antibiotic and other treatments that are part of their regimen that we use to treat that as well. But again, it's one of those things where antibiotic resistance is really biting us in the butt on this. It's gotten harder and harder to treat. It used to be like super straightforward, 2 antibiotics plus something else that you would treat, done, no big deal. And it's getting harder. And some of these people, like, I kid you not, will test for it. And I'll have to go through like 4 rounds of treatment to try to get any, headway. And sometimes still it just keeps coming back positive. And so it's getting more and more difficult to treat for sure.
We probably need a whole episode on antibiotic resistance at
Yes,
some point in time to like
absolutely.
really explain what we're talking about with that, how the community and the population can help with that too.
Yeah, for sure. And and then of course the proton pump inhibitors that I mentioned, they kind of change that acid in the stomach so that it allows that protective barrier to build itself back up so the ulcer can heal. So that's kind of our mainstay of treatment, I would say.
So what can happen if you don't treat an ulcer?
So that's a great question as well. It's an important one too, because they can have their complications. Fortunately, overall, they're rare. So the most common is bleeding, and they can bleed a lot. That is also kind of the bread and butter of what I do is treating gastrointestinal bleeding. And a lot of times it is ulcers that are bleeding. This occurs in about 15% of patients that have peptic ulcer disease. If someone does have a bleeding ulcer, they could show up with vomiting of blood, for example, and that could be bright red blood or that could be darker blood that you may hear the term coffee ground. So basically, if you ever see coffee grounds, that kind of black grainy look as well, that's something that we also ask about. It can also be in their stool. We call that, melena, which is a black tarry stool. And I put in there tarry because there are a lot of things that can cause black stools by themselves. And like, people will tell them they have a GI bleed, but there's a change in appearance, not just color that goes along with that. They could also have fatigue, if you have low blood counts, for example, or you can have lightheadedness as well. They can erode all the way through the stomach or the small bowel, and that's called a perforation. That could require a surgery or a procedure to repair. Thankfully, death from peptic ulcer disease has become a lot more rare with the use of proton pump inhibitors, so we've actually seen that decrease quite a bit. And like I mentioned before, I actually find this fascinating. Okay. So, if you want to talk about getting nerded out on GI, it's right here. So it's really important to treat H. pylori because it actually can lead to cancer. Okay. Rarely, I know, rarely it can lead to a mucosa, so we call it a mucosa associated lymphoid tissue or a malt lymphoma. So that's the kind of the short term for it, which is basically a slow growing type of a non-Hodgkin's lymphoma. And what happens is H. pylori infection in the stomach actually increases that inflammation so much that it basically starts turning into cancer. We all know that inflammation is, a risk factor for that, turning over the cells and everything. And interestingly, patients with gastric malt lymphoma, so stomach malt lymphomas, can actually be given antibiotics first to treat H. pylori. And I've actually seen this happen. And it's basically treating an infection often clears away the lymphoma. Isn't that crazy?
Oh, wow.
Using antibiotics to cure cancer. It's
That's
like
cool.
You don't get to do that very often, but I've literally had that patient where we found that in the stomach, H. pylori positive, and we treated it and it went away. And it's not all the time, obviously, but it's definitely one of the rare things that I get to see.
Okay, that was really cool. Yeah, treating cancer with an antibiotic, that's really neat.
If you want to hear another really cool story, you should Google how H. pylori was discovered to cause ulcers because it's also super fascinating and led to a Nobel Prize for the Australian person that actually did this, and it was by literally swallowing what he thought was causing the peptic ulcers himself and checking himself for ulcers. So but if you want to read an interesting story, I think that's pretty interesting too.
We may have to look that one up later for sure. Thank you, Dr. Sorrell, for demystifying peptic ulcer disease for us. We are glad Mike Tyson is okay. He probably should go get that ulcer checked out if that is the cause, or go see his friendly neighborhood gastroenterologist. Dr. Radford, as always, thank you again for joining us and giving us all the lowdown on all the STIs. We really appreciate breaking down that stigma and letting us really get a good discussion going with you today.
Thank you for having me.
And as a reminder, don't forget to check out our show notes in order to claim your CME credit. Thank you all for listening. As always, please like, subscribe, share the episodes. Let us know what topics you're interested in hearing about through our Instagram, and stay tuned for the next episode.